Hey guys, it's Dr. Donna Ferguson. I'm a child and adolescent psychiatrist in Baton Rouge. You may have seen my videos on ADHD on our Facebook page, Family Focus LLC, or on YouTube. I don't know what the heading of that would be. I think it may be Donna Ferguson, maybe D Ferguson. I'll have to look that up, maybe for the next video. Anyway, this video is about anxiety, and I decided to do a video about anxiety because it is probably what I deal with in my practice even more than ADHD, and it's so misunderstood. So I wanted to just touch on it, and I'm going to do a quick little video on it, what it is and why we care, and then the next video will be what we do about it. So, you know, I like to draw things because I think having a visual is so important. And I drew this. Scooch back so you can see it. So these are some anxieties, and you may not understand my abbreviations, but I have listed them. They're not necessarily coinciding with the DSM-5. Unfortunately, I've been around a little too long, and some of the things that I thought were important, they've taken out. They took out one of my favorite diagnoses called childhood anxiety disorder, or disorder, anxiety disorder of childhood, something like that. But these are the ones that I feel like I deal with most of the time in my practice. Generalized anxiety disorder, social anxiety disorder, panic attacks and disorder. There's a little bit of a difference. OCD, PTSD, phobias, separation anxiety disorder, test anxiety disorder, performance anxiety disorder. Those kind of go together and also lumped together with social anxiety disorder. And then I also threw these on the bottom, the depression with anxiety and adjustment disorder with anxiety, because those definitely come along as issues that propel people who may not normally have tremendous amounts of anxiety into Anxietyville. So the biggest one is generalized anxiety disorder, and I think a lot of people do not understand that generalized anxiety disorder can be so debilitating. People will say to me, you know, I can't get things done because I'm so worried about what people think. I am so worried about what may happen in this situation. They catastrophize. I call it worry forward or worry backward. And some people will say, well, what if this, then this thing might happen, then that thing might happen, and then this horrible, horrible thing might happen, and then it just builds and builds and builds. That's a generalized anxiety disorder presentation. Also, some people may worry backward and say, I shouldn't have done this, I shouldn't have said that, I wish I had done that differently. And so I call those backwards worriers. Some people do both. Those people are really pretty miserable. But it doesn't even have to look just like that. That's the problem with anxiety disorders. Everybody has a different fingerprint. And so when I'm trying to explain this to families, I'll say, you know, your fingerprint is not going to look just like the next one, and neither does your anxiety disorder. And I want to emphasize that I'm using the word disorder because anxiety, we all have anxiety, and anxiety is important. It keeps us safe. It keeps us aware. It keeps us studying for tests. So we always want to have a little bit of anxiety because it keeps us motivated to do things. But when we have so much anxiety that it inhibits us from doing things or interferes with us doing things in an effective and efficient way, then it's considered a disorder. It disrupts our functioning. So I think that's important to understand. So generalized anxiety disorder is the big one. Not everyone resonates with the word anxiety. Some people say, I worry. Some people say, I'm nervous. Some people say, I'm irritable a lot. Some people say, I like to know what to expect. And I get really frustrated when I can't predict what's going to happen. There's a lot of control issues associated with generalized anxiety disorder for some people. It really, again, can look different on different people, but it's just sort of this general worry that is there most of the time since childhood. It is genetic. It is inherited from your parents or grandparents. It is not your fault that you have it. And usually my next question is who in the family has it, because usually someone else also struggles with this. And it can be picked up very early in children because they worry even about things that you would think kids shouldn't worry about. Where's my next meal going to come from? Is someone going to change my diaper even? I mean, I think infants have worries that aren't really fully developed, but I remember noticing my daughter wringing her hands and her feet when she was just an infant, and I thought, she's worrying about something, and she was. She's a pretty big worrier. She has a lot of somatic issues, so worrying about your body or worrying about illness or things like that can be related to anxiety. So generalized anxiety disorder is sort of the catch-all. It's the big one. We're going to move on to social anxiety disorder. That's more your shy people. Typically, it's what we think about as shy people, but some people will say, well, I have learned how to deal with that. I'm not really shy anymore, but they may be very reticent in a new situation, new environment, with new people, experiencing something for the first time, going to a place for the first time. Fear of scrutiny, fear that people are watching them, critiquing them. That tends to be more of our social anxiety people. Panic attacks are very misunderstood. I think that a lot of people say, I have a panic attack and it lasted 3 days. And that's not a panic attack. Panic attacks are discreet. They come out of nowhere. They usually last about 10 minutes. And you feel like you're having a heart attack and that you're going to die. A lot of people show up in the emergency room because it's very out of nowhere. And it definitely feels like an out-of-body experience for a lot of people. It feels like an emergency. And if you've never had one before, it can feel very frightening. So that's a panic attack. It enters Disorderville when you start to fear having them, like you've had enough of them that you then start to fear them, fear having another one. So that can also come with agoraphobia, which means you don't want to leave your house. So there are lots of layers to that one. OCD is a very, very big one. And it is that sticky brain that will not let go. It just will not unhinge from whatever's going on. It usually has repetitive behaviors that go along with the obsessions, behaviors that can be like checking doorknobs. It can be like having to rewrite your notes. It can be those things. It is not having a neat and clean room. It is not having to be organized, super organized. That's called obsessive compulsive personality disorder. If again, disorder, if it's causing a disruption in your life. But just neat freaks, those are not OCD people. And I hear that getting said a lot, and I want to correct that. OCD people are very, very uncomfortable because they really need a lot of control in their lives. And when they don't have that sense of control, they can get very easily disrupted. And OCD can very easily turn into depression. It is difficult to treat with medications, and we'll get to that part in the second video because I don't want to make really long videos. So we'll talk about treatment in the second one. PTSD, we all know a little bit about that. You have to have had some trauma or exposure to trauma or things of that nature. Usually is accompanied by nightmares, avoidance, reliving, all those things. Phobias, that could be just like I'm simply afraid of spiders. I'm afraid of heights. I don't see a lot of that in the office because most of the time those people just avoid the one thing they're afraid of. So I have had people come in who are afraid of elevators because you can't really avoid those. And so we've had to work on that. That tends to be more of a therapy issue versus a medicine issue. So I don't know if you're noticing here, there's a lack of a trend. Not all of these issues that I'm talking about are treated the same way. Separation anxiety is more of something we see in infants or small children, not wanting to go to school, school avoidance. Selective mutism should also probably be added to this list. Test anxiety, performance anxiety, you guys know what those are. So I also have the depression with anxiety because most people who are depressed also exhibit signs of anxiety. What tells me the difference is sort of what came first, the chicken or the egg. If you were already anxious from childhood, then you may carry a discrete, separate anxiety disorder. Can you be depressed and also have an anxiety disorder that started from childhood? Absolutely. But there's a subset of people who get depressed and then get anxious as a new thing. that would fit into this category. Or adjustment disorder, that means something big has happened, like a big breakup or a divorce or a big move, and you have an adjustment disorder. You're not exactly depressed, but you're very anxious as a result of whatever big thing has happened in your life. So that's kind of a ballpark of a lot of the anxiety disorders. I want to show you how this looks to me when I'm thinking about this and how I try to communicate this to patients. So here's one of my nifty little drawings. And so let's see if I can get this on here. I might have to do it this way. This is your day going this way, or maybe life. Let's say it's life, and these are weeks that are going by. So here is your anxious person, and this line here is their threshold for feeling anxiety. And the ups and downs are just our ups and downs of every day. We all have them. This person is our neurotypical person. So I'm not going to say normal. There's no such thing. But this is our person who does not have anxiety. So let's say we just have some ups and downs that all of us, even neurotypical people, might feel. Just ups and downs throughout the day. But at this point, maybe some person's running really late for work. You can see that the anxious person feels it that much. Can you see from that line to way up here? The neurotypical person feels it that much. So neurotypical person is still going to feel anxious. They're only going to feel it that much versus that much. Y'all see that? So we rock along. Days go by. Even anxious people don't always have anxious feelings. So their threshold, there's some things that go below their threshold. But even just day-to-day fluctuations are popping up over their threshold, much more so than a neurotypical person. So at this point, we have, what the heck did I write there? Oh, failed test. So obviously, anyone who fails a test is going to feel tremendous anxiety. Our neurotypical person will feel it this much. Our anxious person will feel it that much. So it feels so much more overwhelming to an anxious person. Same thing, ups and downs. Here we have a breakup. The breakup, and you can just see the trend. The breakup, we all feel it, kind of recover from it, might have a lot more anxiety that kind of keeps popping up, and then here we might have something like a death, and you can see that even takes longer to recover from, but then the sort of jagged day-to-day stuff goes on. And if you're just a neurotypical person, if you kind of block out what I have going on here, those are the things that pop over your line where you feel it. See that? So you're not feeling it all day long every day. Look at this anxious person. They're feeling it almost all day long, almost every day. This is more generalized anxiety picture that I'm showing you. The other ones are certainly more specific to situations. So I want to just get that out there, that this is mostly about generalized anxiety disorder. When I get into treatment, we'll talk a little bit about the differences of the anxiety disorders and what kind of treatments we recommend, and that'll be the next video. Thanks so much. Bye.